We now talk to David Ansara from the Center for Risk Analysis. He joins us via video call. David, thanks for joining us. My first question, what does the center do?
I'm with the Center for Risk Analysis, which is a think tank based in Johannesburg. And we focus on political risk, economic policy, and scenario planning. So we have a number of clients, so domestic and international corporates, financial institutions, foreign missions that are based in South Africa, and we provide them with scenario planning services.
What are your thoughts on the government's response to this crisis?
As the center, we were supportive of the initial lockdown as a way of mitigating the spread of the virus. We are critical of the economic policy ramifications of the lockdown. So the distinction between essential and non-essential services, we think, is actually an arbitrary distinction. And all services in an economy are essential. All profit-seeking activities are essential. So our recommendation there would be to have a phased opening up of the economy. And the real measure, rather than essential versus non-essential, should be, can a specific industry function and operate safely or not?
There is a fine line between keeping people safe and their human rights. How do we toe that line?
The government's response, I think, has been rather blunt, and it is very concerning to see the encroachments on civil liberties. So we have fundamental rights enshrined in the Constitution. Bear in mind that this is a state of disaster, not a state of emergency, so all of those constitutional rights still do apply. There have been a number of incidents of police violence and brutality, also of the SANDF, people being harassed on their front porch or being made to perform humiliating physical exercises as punishment for being outside and in breach of the lockdown protocols. Also, policy interventions like, for example, price controls. Price controls invariably lead to shortages. This is not a time where we want to be meddling with pricing of private providers. And so, we want to ensure that those supply chains are effective, and having fair and adequate pricing is an important part of that.
The Minister of Health talks about the brunt of the crisis only hitting us in September. What could the impact be on the country?
Well, it's very difficult to tell at this point exactly how the virus will play out over the next few months. So we have seen a relative flattening of the infection curve in South Africa. But we must also bear in mind that our testing capability has been very limited. It's also important to note that there is a lot of uncertainty about the morbidity and fatality estimates surrounding the virus. So there is a case fatality rate which is on the up end of about 2%, so 2% of all infected patients will die under that upper end scenario, and on the lower end case fatality rate of 0.5%. For example, in Italy, they've had 160,000 cases and they've had 20,000 deaths. So that's a 12.8% case fatality rate, which is extremely high. Whereas in the United States, they've had the greatest overall number of infections and deaths. So they've had 587,000 infections and 23,000 deaths. But their fatality rate is only 4%.